LDL, so-called bad cholesterol, plays a central role in the initiation, development, and progression of our number one killer. Over 100 prospective studies involving more than 1 million people have demonstrated that those with higher LDL levels are at higher risk. This is a list of diseases commonly found here and in populations that eat and live like the U.S., but were rare or even non-existent in populations eating diets centered around whole plant foods. These are among our most common diseases, like obesity, hiatal hernia, one of the most common stomach problems, hemorrhoids, and varicose veins, the most common venous problems, colorectal cancer, the number 2 cause of cancer death, diverticulosis, the number 1 disease of the intestine, appendicitis, the number 1 cause of emergency abdominal surgery, gallbladder disease, the number 1 cause for non-emergency abdominal surgery, and ischemic heart disease, the commonest cause of death here, but a rarity in plant-based populations. This landmark study suggesting that coronary heart disease was practically non-existent among those eating traditional plant-based diets in Africa claimed that there was adequate autopsy evidence to confirm that fact. Let's look at it. Doctors in sub-Saharan Africa during the 30s and 40s recognized that certain diseases commonly met in Western communities were rare in rural African peasants. This hearsay talk greeted any new doctor on arrival in Africa. Even a teaching manual stated that diabetes, coronary heart disease, appendicitis, peptic ulcers, gallstones, hemorrhoids, and constipation were rare in African blacks who eat foods that contain many skins and fibers, such as beans and corn, and effortlessly pass a bulky stool 2 or 3 times a day. Surgeons noticed that the common acute abdominal emergencies like appendicitis in Western communities were virtually absent in rural African peasants. But do we have hard data to back that up? Yes. Major autopsy series were performed, first 1,000 Kenyan autopsies, not a single case of appendicitis, not a single heart attack. 3 diabetics out of 1,000, 1 peptic ulcer, no gallstones, and no evidence of high blood pressure, which alone affects 1 out of 3 Americans. Maybe the Africans were just dying early of other diseases and so never lived long enough to get heart disease? No. Here's age-matched heart attack rates in Uganda versus St. Louis. Out of 632 autopsies in Uganda, 1 myocardial infarction. Out of 632 Missourians, same age and gender distribution, 136 myocardial infarctions, right? More than 100 times the rate of our number 1 killer. In fact, they were so blown away, they did another 800 autopsies in Uganda, and still, just that 1 small healed infarct, meaning it wasn't even the cause of death, out of 1,427 patients, less than 1 in 1,000, whereas in the U.S., it's an epidemic.